At CSCCE, as we call ourselves, we provide research and analysis on the preparation, working conditions, and compensation of the early care and education workforce. And really, our vision is to realize an effective public early care and education system that secures racial, gender, and economic justice for the women whose labor is really the linchpin of stable quality services. And since our founding in 1999, the center has been learning from and learning with early educators about their experiences, their practices, their needs, their goals. We generate a large body of research and policy analysis on preparation, working conditions, and compensation of the ECE workforce, as well as on systems issues that focus on these areas or influence these areas, such as workforce data and financing. But as it relates to compensation specifically, our most widely utilized resource is the Early Childhood Workforce Index. And in the index, we report on current wages, poverty rates, and occupational rankings of the early care and education workforce. We offer comparisons of early educator wages with teachers of older children and against benchmarks like median and living wages. And we report this nationally as well as for every state. And in the index, we also assess state policies, currently in 5 areas, with compensation being one of these areas. And the policy assessment allows us to report whether a state is stalled or making headway or edging forward in a particular policy area. I think it's first important to distinguish between compensation, meaning ongoing direct pay and benefits like health insurance, paid leave, retirement contributions, distinct from financial relief, which is just that, some relief, but distinct from ongoing wages or what you might see in your paycheck. And financial relief is often paid to educators in the form of stipends or bonuses. That being said, in our current context, I think they both play a really important role. In terms of financial relief, one of the most effective strategies for getting funding directly to the workforce is in the form of stipends, direct payments to individual workforce members. And while many states and local communities have some version of a stipend program and have had it for years, they have typically been limited in scope, meaning all members of the workforce haven't been eligible, and providers are typically required to do something in addition to their work in order to be eligible, like participate in professional development or things like this, work in certain types of programs. The pandemic relief funding has really provided opportunities for new models that establish relationships between public agencies and public funding and our mixed delivery systems. One way that we're seeing states raising compensation is by states providing grants to programs, and then programs in turn using funding to raise wages and provide some of those benefits. That can include health insurance. So here, I think we can look to states like Minnesota, Connecticut, and North Carolina. These are some examples of places that are doing this. And pre-pandemic, this really was kind of a non-starter. If programs were not already participating in public funding for childcare slots or accepting subsidy, it seemed really impossible, actually, to get people to imagine a scenario in which public funding was provided to programs in order to pay wages. But I think now it's not only possible to or impossible to imagine, but it's actually happening. We are seeing states doing this. And in our research here at the center, we have been finding that publicly contracted programs have been more financially stable and better able to support their staff. This has been certainly true during the pandemic when we are able to see which programs have been able to retain staff, where people have been able to continue to pay wages. So for example, if we take public pre-K, that is something that has been moving to scale across states and many communities for that component of the early care and education system. And so what we've seen is that has created greater inequities between what's going on in the pre-K part of the system from the part of the system that serves infant and toddlers. So we really do have to grapple with how big of a change and how much, when we talk about scale, really how big that is if we're talking about something that is actually going to work across the workforce. We have to be thinking about a universal system, which means from a worker's perspective, all childcare workers are participating in this system, and from a parent perspective, that all parents have access to it. And that it is available to them, that it's free to them, or at the very least, it's incredibly low cost, because we know that this is too much for parents to take on, and they can't fund the cost of the system, and certainly the cost of wages. So we really do have to be thinking about this as a way to move a universal system, or we are going to just keep developing these inequities that exist. But we have examples. Like this is, there are examples of how this model can work, what it can look like. Mechanisms that have been built out through American Rescue Plan stabilization grant funding is an example. States are providing grants to programs, and many of those grants are specifying specific funding for compensation. They're specifying financial relief for parents. They're specifying increasing access. So it's doing all of those things with programs. It's also the case that military childcare and Head Start utilize contracts to provide services through a mix of center and home-based programs. So we're not starting from scratch. I think we've got some very important components of our system that already exist in this way that we can learn from. And we can do this while maintaining, some level of childcare vouchers for circumstances that can't otherwise be met in group childcare settings. But that really, I think, is going to be the key to creating something that is equitable and effective really across the system.